Good afternoon, all. I welcome you all for this special FB Live phone in program organized by the All India Institute of Speech and Hearing, Mysore. Today, we are here commemorating the Balance Awareness Week, which took place from 15th to 21st September 2024. The Balance Awareness Week is an observance designated by the Vestibular Disorders Association, and this aims to increase the awareness about the vestibular and balance disorders. So, together, we can support individuals battling from dizziness, vertigo, and imbalance for life to be rebalanced. The All India Institute of Speech and Hearing, popularly known as AISH, is an esteemed institute in the field of speech and hearing in the Southeast Asia. AISH promotes human resource development, research, clinical care, and public education, and we conduct a wide range of clinical activities to create awareness. In this connection, this live phone-in program has been organized around this year's Balance Awareness Week, and we are here to raise awareness and address questions from our audience related to balance disorders. Today, we have two subject experts with us to share information of vertigo and balance disorders and its management. Firstly, I would like to introduce Dr. Sujit Kumar Sinha, who has been working as an associate professor in the Department of Audiology. I extend a warm welcome to you, sir. And I would also like to welcome Dr. Neeraj Kumar Singh. He has been working as an associate professor in the Department of Audiology, AISH. I welcome you to the program, sir.
Thank you, Aishwarya.
And myself, Aishwarya Nagarajan, working as a junior research fellow, Department of Audiology, and I will be moderating this session. So with this, I think we are good to go with the discussion. And dear audience, please note that this is a live phone-in program and you can reach to us by dialing the number 0821 250 2530. You can also post your questions on our FB live page or YouTube channel where this episode is getting live streamed. So let's start with the program. Sir, to start with this vertigo, what exactly do we mean by vertigo, sir? And how is it different from the regular dizziness?
There are actually different terminologies that we need to differentiate. Now, there are different terminologies used by the patient when they report to our clinic. Few patients will say that I have vertigo. Few patients will also say that I have giddiness. Other patients will say that I have imbalance, dizziness. So now we need to differentiate this terminology specifically. When I say vertigo, most of the time vertigo means that it's a spinning sensation. Spinning sensation means there can be two types of spinning sensation which a patient can experience. One is that wherein the patient will feel that the entire surrounding is moving around him or her, and second one is that wherein the patient feels that he himself or she herself is moving around the surrounding or the environment. This is typically a spinning sensation, and most of the time the vertigo is referred to as a spinning sensation, wherein it's a kind of a false sensation. It is not that actually the building is moving or actually the person is moving. It's a false sensation. Giddiness is a kind of a lightheadedness or a railing sensation in the head which the patient will experience. Dizziness is more a broader term. It's a more a broader term which can include giddiness also and which can include the vertigo also. Sometimes some patient will also report of syncope. Syncope is something wherein the patient will become unconscious, and most of the time this syncope is a more significant diagnosis, because most of the time the syncope is either caused because of a cardiovascular disease or it is caused because of certain neurological issues. So these are the terminologies the patient have to understand or the public have to understand.
Thank you, sir. Sir, the next question is to you. So what are the common triggers of vertigo? Like recent times, most of the youngsters are suffering from this stress and anxiety. So do they trigger vertigo?
Yeah, that's a very nice question actually. Vertigo can be triggered by many things, like simple triggers, and the most common trigger of vertigo is a change in body position. Some people suffering from a disease called or a disorder called as the benign paroxysmal positional vertigo. Those are the people, if they change their body position, for example, if they lie down from a sitting position, they go to a lying down position, or if they are lying down and they suddenly sit up, or they turn in the bed from one side to the other side, or sometimes women while cooking in their kitchen just suddenly look up to get something from the shelf. or bend down. Any of these things, these are called as change in body positions, and these change in body positions can be the most common trigger, because BPPV is the most common vertigo condition. But apart from that, vertigo can be triggered by many other things, like while you are traveling, it could be there. You eat certain food items. Uh, for everybody, the same food item will not cause vertigo, but for different people, different food items could cause vertigo. Or you have issues with gastric issues, even that can cause. And likewise, stress can also cause. So many times what happens is, if a person has got migraine, slowly this migraine may convert into a vestibular migraine, where the inner ear also gets affected. So in such situations, when the person is under stress, stress generally induces a migraine attack. And for people in whom the inner ear is also involved, the stress will induce a migraine attack where the inner ear will also be affected, and because of that, the stress can also cause it. And stress otherwise also can cause a rise in blood pressure. So hypertension can also be a cause of vertigo. So stress can cause vertigo via many different ways. And yes, you're right that way, that stress can cause anxiety, can cause vertigo, but it doesn't do it in everybody. When people have got other conditions, the stress can actually increase that condition, thereby also resulting in vertigo.
Thank you, sir. So the next question is, like, are there any specific set of populations for whom vertigo is more common, like any gender or any specific health conditions?
Uh, there is no age bar. The vertigo can occur in children also, the vertigo can occur in adults also, and the vertigo can occur in geriatric population also. So actually, it can affect a child also, and it can affect an older person also. But most of the time, when you see the patient in the clinic, typically a person aged above 40 years coming to the clinic are more common, and children reporting to clinic with problem of vertigo is less, because it may be possible that children are not able to understand the problem what they are facing. They don't understand that, what is the kind of problem that is happening, and what is that kind of sensation they are experiencing, so they may not be able to express themselves. That is where the reporting of these patients may be less in pediatric population. But if I look at the data of among and the older population, definitely in the older population, the balance issues or the vertigo issues are more compared to the younger population. That is another thing. And if you look at overall data also, you will find that females are more affected by vertigo compared to males. So females have more issues compared to the males with respect to the vertigo. But as such, the vertigo can occur in pediatric population also, adult also, and geriatric population also. Particularly aged above 40 years, when you look into, most of the patients will be aged between 40 to 80 years. That is where you will find most of the patients coming to the clinic.
Thank you, sir. So, moving on to the symptoms and diagnosis. Sir, more often people think that when they have vertigo, it is something serious, like they have something related to their brain or nervous system. Is it that way every time, sir?
You're right, because it's a very scary symptom. Unless you have had a vertigo, you will not know how scared a person could get when you know that nothing is spinning, but you're feeling that everything is spinning around, or you know that the surface is stable, but you're not able to walk on it. You are being pushed to one side. You feel like somebody is pushing you and you're falling to one side. So when these conditions start suddenly, people could get scared. They could panic, and they could uh, it could really bother them. That could increase their stress levels and all, and make the condition worse. So therefore, uh, it is important to notice that there is a problem. However, they need not have to panic, and it is not always serious. See, there are certain conditions which are serious, which lead to vertigo. For example, somebody has a stroke. Sometimes stroke can be associated with vertigo. So I would not say that stroke is not a serious symptom. Likewise, if somebody has got tumor in the brain, that can also lead to issues like imbalance or sometimes vertigo also. So such situations are serious and need to be looked at seriously. But say somebody having a stroke, now if a person is having vertigo, he doesn't know whether it is because of stroke. So should he rush to the hospital or should he not? So if he just needs to notice some simple signs like you start losing sensation in some part of your body, or you feel numbness in some part of your body while trying to speak, if the speech is not coming out clearly as it normally does, when you are looking at things, then you know there is one thing but you are seeing two images, you are trying to stand but you are unable to maintain a standing posture, you are falling, so you need somebody's support, or even when somebody makes you sit up straight, you are always uh, leaning towards one side, even though you want to sit straight, you are not able to do. So when you notice such kind of symptoms, these are called as soft neurological signs. So when these kind of soft neurological signs are present, then the person should bother and go to a hospital where emergency care can be given. Whereas for all other conditions of vertigo where soft neurological signs and all are not there, you need not have to panic. You can take your time, stabilize, go to any nearby hospital, and with little bit of treatment, it will stabilize a little bit, and then subsequently it can happen. So when vertigo suddenly starts, it has never happened before, you did not realize anything, and then suddenly all of a sudden it starts, this is called as acute onset vertigo. It can happen in stroke cases, but it can also happen in infections of the inner ear. So if there is an infection, soft neurological signs won't be there, but if there is a stroke, there will be some or the other soft neurological sign. I just mentioned some of them. So if those are present, you need to still not press the panic button, but seek immediate help, go to a hospital with such kind of services available. And if such thing is not there, then you can see any vertigo clinic anywhere where the treatment for vertigo is being done. You could seek help from there.
Thank you, sir. Sir, so when you encounter patients with vertigo, can you please tell us what are the other signs and symptoms you see them apart from vertigo? What do they like? What are the other complaints they tell?
Actually, when I look at the patients coming and reporting to me with vertigo issues, actually they have a spectrum of symptoms. They don't have only one symptom that is there. They have a spectrum of symptoms that is present in them. Most of the patient when they come, they generally report that they have vertigo. But when you go on inquiring about the sign and symptoms, what actually they mean by vertigo and what is the actual sign and symptoms they are experiencing, many of the patient will not have actual vertigo, not have actual spinning sensation. They will have more of like kind of imbalance wherein the patient tries to stand and feels that he or she is going to fall down, or patient when they start walking they feel that when they will walk they are going to fall down. So they also have a kind of a falling sensation which will be present. Again, the patient, a group of patient also might say that apart from vertigo, that is the spinning sensation, when they are walking, their body is being pushed to one side, as if somebody is pulling from one side or somebody is pushing from one side. They cannot walk in a straight line, it gets deviated from the midline, and they feel that they are going to fall towards, or the body is swaying towards a particular side. Another problem which they will say is that vomiting. Few patients will say that they have that vomiting sensation after the episode of vertigo they are experiencing, or many of them will report that after each episode of vertigo they will have this issue, like how uh, and also that many patients will have this issue in a specific time, specific positions. Okay. Now suppose for example, as discussed for the BPPV by Dr. Neeraj, that they will have vertigo only during the change in the head positions. Otherwise, if they are sitting in a particular posture, they will not get vertigo. Okay, in the conditions with BPPV. And patients who will have vestibular migraine, they will typically report of headache, and the headache will be located to one side of the head. It will not that entire head will have some kind of pain. One-sided headache. It will be a kind of a pulsating headache, wherein the patient will feel that from inside somebody is hammering that pain in between. It increases and decreases. so one-sided headache. And then they also report of phonophobia. Phonophobia is that whenever they have headache or whenever they have vertigo, they have irritation to certain sounds at that point of the time. They don't want to listen to loud sounds. They don't want to listen to some specific sounds. Also, they will have photophobia, wherein they don't want to see the bright light. Whenever they get headache or whenever they have vertigo, all that they want to do is switch off the light in the room, put the curtains on, and they want to sleep. These additional symptoms which will be present. Apart from that, few patients who suffer from a condition which is called as Meniere's disease, they will also report of a continuous tinnitus. So tinnitus is nothing but they will feel that there is some sound being generated in the ear, and it is in the absence of any kind of sound coming from the environment. Actually, environment there is no sound present, but they will hear some sound, and that tinnitus will be present 24 hours around the clock. And also they will have hearing loss, and plus the episodic vertigo. That means say that vertigo will come at a regular interval. Say that every 1 month they will get it, or every 2 months they will get it, or every 3 months will get it. So it also depends upon the etiologies or the causes of the vertigo, which they are disease which they are suffering from. So these are the signs and symptoms typically apart from the vertigo the patient will report of.
Thank you, sir. Sir, if a person is experiencing vertigo for the very first time and he is scared about it, so what are the advice you would give? Like, what should they do? What are the immediate actions they should take, and whom should they consult?
Yeah, that's actually something that needs to be addressed. People need to be aware of it. Therefore, I will definitely say that's a very, very, very important question that you bring up. As I said in answer to the previous question, that vertigo may be suddenly occurring. I mean, someday for everything there is first time. Anything in life, we've done it for the first time, and then subsequently we've done it several times. So, likewise, vertigo could have a first appearance someday. So, when it occurs for the first time, the first thing that I suggest to patient or to anybody, I mean, all those who are listening who've never had vertigo before, but if you ever have vertigo, remember the first thing: do not panic, because once you panic, things become worse. You panic, you make wrong decisions. You you should keep your calm. If you can, try and notice what else is happening along with that. So I just described some of the soft neurological signs. So they could think that is are the soft neurological signs there? Am I able to speak? Can people understand? Am I and some things you can judge on your own. When you're speaking, you're not getting sensation on your tongue, so it feels like a dragged kind of speech, not clear speech. Looking at one person, you know there is only one person, but you are seeing him as two images. So all those different soft neurological signs that I described earlier, you need to notice, because only presence of that indicates it is dangerous. The time you know it's not very dangerous, then obviously you will be little more calm. But it's hard to tell a person, like a person is experiencing vomiting sensation along with that, or is actually vomiting. Say an attack has been going on for last 15 minutes and you vomited a couple of times within that, you start feeling really weak, you are likely to be scared of the situation. But still, if you keep your calm and notice that these soft neurological signs are not there, then you need not be scared of the situation. You still have to tackle the situation. You still need to go to the hospital and get yourself treated. Now, it depends upon, okay, first time it occurred, but whether, how long it's been there. Because normally, say somebody with a BPPV also, for the first time, the person is lying down in the bed and turns, and then suddenly everything starts spinning. Many a times it happens in the middle of the night. Things start happening like that, you tend to be scared. The person may end up vomiting also, or feel like he or she might vomit. So, but it will last only for a few seconds to maximum a minute or so, and then it calms down. And then when the patient makes another movement like that, and it triggers again. So in such situations, it is highly likely to be BPPV, but you can't be absolutely certain. Please always remember to notice the soft neurological signs that are there, because positional vertigo can also occur in central pathologies, that is the nervous system. When the brain is having some problem, it can also occur. So in such situations, it would be like that. Then there could be other causes of episodic vertigo like Meniere's disease. So there the vertigo will last for half an hour, 45 minutes, an hour or something like that. It will still have all these symptoms like Dr. Sujit just described, that the person may start feeling reduced hearing in one ear, then may start feeling sound when there isn't a sound. So that's called tinnitus, and you are the person is hearing that. So if you are able to notice these small signs, so that could be a Meniere's disease, and you don't need to be bothered about it so much. You can visit an audiologist or a ENT doctor the next day. I think you
Just
can
a
take
minute,
the
we
phone
can-
call.
Hello. Hello, good afternoon.
Hello, good afternoon.
Good afternoon. Good afternoon, ma'am.
My name is Swati.
Okay.
I'm calling from Shimoga.
Okay.
I just wanted to ask a question.
Okay.
I am having fear of heights from the childhood.
Okay.
And when I am going to somewhere like little height or even where playing in a swing also will create some kind of uncomfortability, kind of spinning sensation, but I'm not very sure.
Okay.
So I just wanted to know, is there any relation between these two, like fear of height and having a spinning sensation, or how that related?
Would you like to address about these issues?
Yeah. No, fear of height is a real situation, and to be truthful with you, even I have fear of height, but it's not fear of small heights that I have. When I'm standing on a very high place, I also tend to feel that. So
Okay.
uh, it is not really a pathology. There is a lot of psychology with it, means the thought process in your brain, what all it does. So if you think that, if you look at something from a height and you think that I'm going to fall and what will happen, so it will trigger uh, what we call in scientific literature as autonomic nervous system response, wherein your heartbeat could start increasing, you will start sweating. Because of that, you have that fear factor is increasing. All that may happen. So if it is really bothering you, I think you need to visit a professional, and it has a treatment and it can be treated. It is possible to treat it, but it requires long term treatment. It can't be treated in a day, and there is no medication for it. So you will have to attend sessions of counseling and therapy, in which slowly desensitization will be done for different heights. And eventually, I mean, everybody is scared of very high places, but for a small height like standing on a first floor, if you're scared of that height, then it obviously requires addressing. So it can help you.
Okay, sir. Yeah. Thank you so much.
Thank you, Swati. Hope the question has been answered. Thank you, sir. So, continuing with the previous question.
Yes.
So, what would they need to do, like when they experience vertigo for the first time? You had told us few advices which we need to follow. So, is there anything you would like to add on, sir?
Yes, so as soon as possible, it is better to
Profession.
seek the advice of medical professionals, depending upon whether you notice those other symptoms or not. So if you notice those other symptoms, as I said before, you need to go to a hospital immediately. It should be a hospital where emergency care is possible. But if it is more like short duration vertigo and then it has stopped and then it may occur again, things like that are happening, then you don't need to be that bothered. You can still take your time and go to a hospital the next day. And if it's been there for some time, and say in the night or for rest of the day you had one or two episodes, and you can go and visit an audiologist or a ENT doctor. But make sure that these people are the ones who are trained in such thing. Not everybody manages people with vertigo, even among the same professionals. Like not all audiologists will manage patients with vertigo. Likewise, not all ENT doctors will manage patients with vertigo. There are some specific people who are trained, so if you know them, it's better to go to them and get the treatment done. So some things require emergency care and you need to go to the emergency departments, and some things can be taken more easily, although not lightly. But again, you need to visit a professional. Unless you do that, you get yourself evaluated and then the treatment is begun, it will not go on its own.
Thank you so much, Dr. Neeraj. Sir, as hope our audience would have known what is vertigo actually. So now, when they come to us, the audiologists, so what are the tests available to assess them, and how do we diagnose that so and so patient has vertigo and not the other regular disease?
See, what happens is that when we have to understand that the test available, we have to just understand some basics. This vertigo issues can occur because of a problem to the inner ear, which we call it as vestibular system. Vertigo can also occur if there is a problem with the central nervous system, that is the brain. The vertigos can also occur if there is a problem with the cardiovascular system. Okay, so there are multiple places where there can be a damage and this vertigos can start. Now, if you ask that, as an audiologist, what are the tests which we are doing, or what are the tests in general which are available for the assessment of vertigo, then first is that the first part which comes is the inner ear, which is the vestibular system. We say that what are the tests which are available for the vestibular system. So as the ear is also responsible, ear can also be responsible for the generation of vertigo.
Excuse me, sir, you can attend the call. Hello, good afternoon. Hello, good afternoon, sir.
ಗುಡ್ ಆಫ್ಟರ್ನೂನ್ ಮೇಡಮ್.
Yes, sir.
ಮೇಡಮ್ ಅದು ನಂಗೆ ಸ್ವಲ್ಪ ಹೆಂಗಂದ್ರೆ ಡೈಜೆಸ್ಟ್ ಬರೋದು ನಂಗೆ ಪ್ರಾಬ್ಲಮ್ ಆಗಿತ್ತು ಮೇಡಮ್. ಮತ್ತು ನಾ ಎಲ್ಲ ಲೈಕ್ ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಮಾಡ್ತಿದ್ದೆ, ಆಮೇಲೆ ಹೈಡ್ರೀನ್ ಟೆಸ್ಟ್ ಮಾಡ್ತಿದ್ದೆ, ಆಮೇಲೆ ಇದು ಏನು ಹೇಳ್ತಾರೆ ಮೇಡಮ್, ಇನ್ನೊಂದು ಟೆಸ್ಟ್ ಎಲ್ಲ ಅದು ಮಾಡ್ತಿದ್ದೆ ಮೇಡಮ್. ENT ಹೇಳ್ತಾರಲ್ಲ, ಇಯರ್ ನೋಸ್ ಥ್ರೋಟ್ ಟೆಸ್ಟ್ ಅದು ಮಾಡ್ತಿದ್ದೆ ಮೇಡಮ್. ಅದು ಇಲ್ಲ ಕ್ಲಿಯರ್ ಐತಿ. ಅದು ನನಗೆ ಬ್ಯಾಲೆನ್ಸಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಆಗುತ್ತೆ ಮೇಡಮ್. ಲೈಕ್ ಈಗ ಗಾಡಿ ರನ್ನಿಂಗ್ ಮಾಡ್ಬಂದ್ರೆ ಸ್ವಲ್ಪ ಸಡನ್ ಪ್ರಾಬ್ಲಮ್ ಆಗುತ್ತೆ ಮೇಡಮ್.
ಓಕೆ, ಸೊ ಗಾಡಿ ಓಡಿಸುವಾಗ ನಿಮಗೆ ತಲೆ ಸುತ್ತು ಬರುತ್ತಾ?
ಹಾಂ, ತಲೆ ಸುತ್ತ ಅಂದ್ರೆ ಸ್ವಲ್ಪ ಮೇಡಮ್, ಲಿಟಲ್ ಬಿಟ್ ಲೈಕ್ ಫ್ರಾಕ್ಷನ್ ಆಫ್ ಸೆಕೆಂಡ್ 0.2 ಅಷ್ಟು ಬರುತ್ತೆ. 0.205 ಸ್ಲೈಟ್ಲಿ ಬಂದು ಹೋಗ್ಬಿಡ್ತೀರಿ ಮೇಡಮ್.
ಓಕೆ, ಸೊ ನಿಮಗೆ ಇದು ವರ್ಟಿಗೋ ಥರ ಬರುತ್ತಾ? ಹಂಗಂದ್ರೆ ಲೈಕ್ ಫುಲ್ ತಿರುಗ್ ಥರ ಬರುತ್ತಾ ಅಥವಾ ಬರೀ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಥರ ಬರುತ್ತಾ ಸರ್?
ಮೇಡಮ್ ಸ್ವಲ್ಪ ಸ್ಲೈಟ್ಲಿ ಮೇಡಮ್.
Slightly imbalance. Sir, so when he rides, he is getting
ಈ
imbalance.
ಬರೀ ಗಾಡಿ ಓಡಿಸುವಾಗ ಇದು
ಗಾಡಿ ಓಡಿಸುವಾಗ ಸರ್ ಲೈಕ್ ನಂದು ಈಗ 15 ಡೇಸ್ ಸರ್ ಏನಾಗಿತ್ತು ಅಂತ ಹೇಳಿದ್ರೆ ನಾವು ಒಂದು ಟ್ಯಾಬ್ಲೆಟ್ ತೊಗೊಂಡಿದ್ದೆ ಸರ್. ಅದ್ರ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಫೋಟೋನು ನಿಮ್ಗೆ ವಾಟ್ಸಪ್ ಮಾಡ್ತೇನೆ ಸರ್. ಅದು ನಮ್ಗೆ ಏನ್ ಗೊತ್ತಿಲ್ಲ, ಡಾಕ್ಟರ್ ಕಡೆ ಕನ್ಸಲ್ಟೆನ್ಸಿ ಮಾಡ್ತಿದ್ದೆ ಮನೆ ಕಡೆ. ಅವ್ರು ಒಂದು ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಕೊಟ್ಟಿದ್ರು 15 ಡೇಸ್ ಅಂತ. ಅದನ್ನ ಯೂಸ್ ಮಾಡಿದ್ದೆ ಸರ್. ಏನಾಗ್ತ ನಂಗೆ ಏನು ಪ್ರಾಬ್ಲಮ್ ಇದಿಲ್ಲ, ಪ್ರಾಬ್ಲಮ್ ಆಗಿಲ್ಲ. ಆಮೇಲೆ ಏನಾಗ್ತದೆ ಲೈಕ್ ಮತ್ತು ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟಲ್ ಒಳಗೆ ಮಧೇಶ್ವರ ಕಡೆ ನಾವು ಹೋಗಿದ್ದೆ ಸರ್. ಅಲ್ಲಿ ಹೋದಾಗ ಏರ್ ಕಿಂಗ್ ಅವ್ರು ಬಂದಿದ್ದು ಕೊಟ್ಟಿದ್ರು, ಡ್ರಾಪ್ಸ್ ಕೊಟ್ಟಿದ್ದೆ ಸರ್. ಅದು ಡ್ರಾಪ್ಸ್ ನ ಹಾಕೊಂಡೆ, ಮತ್ತೆ ನಂಗೆ ಏನು ಪ್ರಾಬ್ಲಮ್ ಆಗಿಲ್ಲ. ಮತ್ತೆ ಬಿಟ್ಟೆಲ್ಲ ಈಗ ಪ್ರಾಬ್ಲಮ್ ಆಗಿತ್ತು. 15 ಡೇಸ್ ಏನಿದ್ರು ಪ್ರಾಬ್ಲಮ್. ಈಗ ಇವತ್ತು ನಿನ್ನೆ ಇವ್ನಿಗೆ ಆಕ್ಚುಲಿ ನೈಟ್ ಅಂದ್ರೆ ಪ್ರಾಬ್ಲಮ್ ಸ್ಟಾರ್ಟ್ ಆಗ್ತದೆ.
ಈ ಪ್ರಾಬ್ಲಮ್ ನಿನ್ನೆಯಿಂದ ಆಗ್ತಾ ಇದೆಯಾ ನಿಮಗೆ?
ಹೌದು ಸರ್, ಹೌದೈತಿ. ನಾ ಗಾಡಿ ಮೂವ್ಮೆಂಟ್ ಮಾಡೋಕೆ ಒಂದು 10 ನಿಮಿಷ ಆಗುತ್ತೆ ಸರ್. ಲೈಕ್ ನಾನು ಆ ಟೈಪ್ ಏನು ಸಿಗುತ್ತಿಲ್ಲ ಸರ್. ಸಮ್ ಟೈಮ್ಸ್ ಹಿಂಗೆ ಆಗುತ್ತೆ ಸರ್. ಗಾಡಿ ಮೂವ್ಮೆಂಟ್ ಇದ್ದಾಗ ಸಡನ್ಲಿ ಆಗುತ್ತೆ ಸರ್, ಮತ್ತೆ ಹೋಗ್ಬಿಡುತ್ತೆ.
ಹಾ. ನೀವು ಒಂದು ಕೆಲಸ ಮಾಡ್ಬೋದು, ನೀವು ನಮ್ಮ ಸೆಂಟರ್ಗೆ ಬಂದು ಒಂದ್ಸಲ ವಿಸಿಟ್ ಮಾಡಿ. ಇಲ್ಲಿನ ನಮ್ಮ ಹತ್ರ ಬೇರೆ ಬೇರೆ ಥರ ಇನ್ಸ್ಟ್ರೂಮೆಂಟು ಮತ್ತು ಟೆಸ್ಟ್ಸ್ ಎಲ್ಲ ಅವೈಲೇಬಲ್ ಇದೆ. ನೋಡ್ತೀವಿ, ಒಂದ್ಸಲ ಟೆಸ್ಟಿಂಗ್ ಮಾಡಿಬಿಟ್ಟು ಹೇಳ್ತೀವಿ ಎಂಥ ಪ್ರಾಬ್ಲಮ್ ಆಗಿದೆ ಅಂತ ಫಸ್ಟ್ ನೋಡ್ಕೋಬೇಕು. ಹಾಗೇನ ಸಡನ್ ಆಗಿ ಏನಾದರೂ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದಾಗ ಹಾಗೆ ಸಜೆಸ್ಟ್ ಮಾಡೋಕ್ಕೆ ಆಗಲ್ಲ. ಸೊ ನೀವು ನಮ್ಮ ಸೆಂಟರ್ಗೆ ಬಂದರೆ ನಾವು ಟೆಸ್ಟ್ ಮಾಡಿಬಿಟ್ಟು ಹೇಳ್ತೀವಿ ಯಾವ ಥರ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಅಂತ, ಮತ್ತು ಯಾವ ಥರ ಚಿಕಿತ್ಸೆ ಆಗತ್ತೆ ಅಂತ ಡೀಟೇಲ್ ಆಗಿ ನಾವು ಹೇಳ್ತೀವಿ. ಆಯಿತಾ?
ಈಗ ನಿಮ್ದು ಯಾರು ಬರ್ತೀರಿ?
ಹಲೋ.
ಹಲೋ ಸರ್.
ಹಾಂ ಹೇಳಿ. ಹಾಂ ಹೇಳಿ.
ಲೊಕೇಶನ್ ಎಲ್ಲಿ ಬರುತ್ತೆ ಸರ್?
ಇದು ಅಖಿಲ್ ಭಾರತೀಯ ವಾಕ್ ಶ್ರವಣ್ ಸಂಸ್ಥೆ, ಮಾನಸ ಗಂಗೋತ್ರಿ, ಮೈಸೂರಲ್ಲಿ ಇದೆ. ಓಕೆ, ನೀವು ಎಲ್ಲಿಂದ ಕಾಲ್ ಮಾಡ್ತಾ ಇರೋದು?
ಗದಗ್ ಸರ್.
ಎಲ್ಲಿಂದ?
ಗದಗ್ ಸರ್, ಗದಗಿಂದ.
ಗದಗಿಂದ.
ಹುಬ್ಳಿ ಗದಗ್.
ಆಹಾ, ಇಲ್ಲಿ ಇನ್ಸ್ಟಿಟ್ಯೂಟು ಸಂಸ್ಥೆ
ಸರ್ ಹುಬ್ಳಿ ಕರ್ನಾಟಕ ಸರ್.
ಹಾ ಹಾ, ಇದು ಮೈಸೂರಲ್ಲಿ ಇದೆ.
ಹಾಂ ಸರ್.
ಹಾ, ಓಕೆ.
ಓಕೆ ಸರ್, ನಿಮ್ಮ ತೊಂದರೆಗೆ ನಮ್ಮ ಸಂಸ್ಥೆ ಬಂದು ತೋರಿಸಿ.
ಹಾಂ ಮೇಡಮ್.
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
Okay, so I was telling that it depends upon that which all test we need to administer. So here typically we start with doing a protonodiogram so that we understand whether the person has any kind of hearing loss or person does not have hearing loss. Then we also look into tympanometry, which tells about basically middle ear function. Then we do auditory brainstem responses, which tells about the auditory nerve function. And then we go ahead with the vestibular test in a specific. Among the vestibular tests we have is, first one is the vestibular evokomyogenic potentials, which assesses the otolithic, a particular organ of the vestibular system. Then we have is video head impulse test, which assesses semicircular canal function. And then we also have the VNG, video nystagmography test. And video nystagmography basically tells us about the connection between the central nervous system and the eyes, whether they are fine and the problem is because of that. And there are other tests which are also available, such as called as posturography or craniocarpography, etc. Then the whole set of tests need to be administered in order to understand whether the vertigo which is there in the patient is because of inner ear problem or is because of some other problem which is there with the patient. So a set of tests needs to be administered.
Thank you, sir. Sir, as you had told that even neurologists and ENT play a crucial role in diagnosing and managing vertigo. So we as an audiologist, how do we collaborate with them in diagnosis and management?
Yeah, it's not just neurologist or ENT. Of course, those two professionals are more often involved, and we need to talk to them more often. To sometimes, I mean, this I would want to divide the answer to this question in two different ways. One is for the diagnosis purpose, means I need to know what the condition is, and the second one is for the treatment. So, in terms of diagnosis, there could be certain neural conditions where our nerve fibers in the brain, different structures in the brain, any of those are affected. So if any of those are affected, then I need more of a neurology consultation, and the neurologist can give their opinion about whether there is a neural problem or not. And for that, they may refer the patient for certain radiological investigations, or sometimes even blood investigations and all that, because sometimes even like diabetes, hypertension and also cause. So in if these are the conditions, if this is a known diabetic or a known hypertensive, then I can get their evaluations done. uh, Sometimes the physician can also give us a good input on that, whether it's a controlled diabetes, uncontrolled diabetes, or likewise hypertension is under control or not. So even they can give us input. Sometimes some people, especially in old age, although it is not necessary that it happens in old age, sometimes in old age, I think we can take
We
this
can take
question.
the call. Hello, good afternoon. Hello.
Good afternoon, madam. I am calling from Chennai.
Yes, ma'am.
எனக்கு ஒரு வெஸ்டிபுலர் அதில் ஒரு டவுட் இருக்குது. ஏர்லி மார்னிங் 3 o'clock எந்திரிக்கிறப்போ கொஞ்சம் ஒன் சைடு ஹெட் இருக்குது.
Okay, ma'am.
இருக்கிறப்போ
Okay.
கொஞ்ச நேரம் ஒரு half an hour இருக்கும். அது கையெழுத்தாக இது இருக்கு. half an hourக்கு அப்புறம் காஃபி டீ எடுத்துட்ட பிறகு அது சரியாயிடும். இதுக்கு நான் ஆக்சுவலாக இது எதுக்காக அலோபதி டேப்லெட்ஸ் எதுவுமே நான் எடுத்துக்கிறது இல்லை.
Okay.
அப்புறம் நார்மலாக ஆயிடுது.
Okay.
ஏதாவது எக்ஸசைஸ் ஏதாவது இருக்கா அந்த டேப்லெட்ஸ் இல்லாம யூஸ் பண்றதுக்கு? இந்த ஹெட்ஏக் ஏர்லி மார்னிங் எந்திரிக்கிறப்போ இருக்கு அந்த மாதிரி லைட்டா.
உங்களுக்கு வெர்டிகோ கிட்டினஸ் மாதிரி ஏதாவது இருக்குங்களாமா?
கிடினஸ் இல்ல, கொஞ்சம் எந்திரிக்கிறப்போ கொஞ்சம் லைட்டா ஹெட்ஏக் மாதிரி தான் இருக்குது. கிடினஸ் எதுவும் கிடையாது. அது வந்து தூக்கத்துல எந்திரிக்கிறனால அப்படி இருக்கும் போல இருக்கு அப்படின்னு. பட் அந்த மாதிரி வருது. ஆனா காஃபி டீ சாப்பிட்ட பிறகு அது சரியாயிடுது. ஒன் சைட் ஹெட்ஏக்கான்னு கொஞ்சம் டவுட்டாகவும் இருக்கு.
Okay.
லைட்டா இருக்கு. அது அதனால அது டெய்லி நான் 3 o'clock எந்திரிக்கிறனால கொஞ்சம் அவனோட ஒர்க் அந்த மாதிரி, அதனால அந்த மாதிரி இருக்குமான்னு தெரியல.
ஓகே மேம்.
அதுதான் அதை பத்தி அதுக்கு ஏதாவது எக்ஸசைஸ் இருந்தா ஸ்லீப் பண்றதுக்கு ஏதாவது இருக்குமான டாக்டர் கிட்ட கேட்டுக்கொண்டது.
ஓகே மேம்.
Yes, we can.
Oh,
Yes, sir.
I can understand what she said, but
So it's like
I can't speak in Tamil. I understood what she said. Probably one-sided headache in the morning.
Exactly.
After
Wakes
after it
up.
stays for half an hour or so, and then after that she has tea, coffee, and all that, and then it
It
becomes all
subsides.
right.
Yeah.
Seems more like a case of migraine with whatever description she has given, but obviously it needs a neurological consultation to confirm that it's migraine. And once it is confirmed it is migraine, then the migraine treatment, medical treatment of migraine happens. But one advice I would like to give her is she can chart her activities. Like, does it happen every day, or does it happen on days on which the previous night she hasn't slept well? Sometimes maybe the previous night or the previous day some event happened because of which she has been thinking and that has disturbed her sleep, because migraine will have these kind of specific triggers. Or does she consume something the previous night? Means she needs to chart out exactly what she has done throughout the day, every day for say a month. Then say you make a chart where you say, okay, today's date, I woke up at this time in the morning. Did I have headache? Not have headache. Did I have vertigo? Not have vertigo. All those things. Plus, at what time I did my regular routines. What time did I have breakfast? What did I have for breakfast? With specifics, like don't just say that I had chapati and vegetable or something like that. You say, okay, chapati was made up of wheat, made up of rice, or what? So that you need to say which vegetables you had. So whether you had potatoes, or you had tomatoes, or you had, and what were the main ingredients there. So like that for every meal, and for throughout the day, what time you went to sleep. Did you get good sleep at night? Did you feel tired when you woke up in the morning? That means that you probably didn't sleep well the previous night. Like that. So every day when you chart out, and also mark whether on that day you had headache or didn't have headache. So that way you will be able to figure out what were the common things among the days on which I had this headache or vertigo. So based on that, a lot of times patient himself or herself can make it out, or sometimes just giving this chart to the professional, and professional can easily make out what were the triggers. So avoiding those triggers can help her. So this is a way in which even when a patient comes to me with a complaint of migraine, I will suggest the same thing. But in addition to that, it needs a diagnosis by the neurologist. So if she can visit a neurologist, get herself evaluated, and if it is migraine, identify the triggers, and just avoiding the triggers can actually help her a lot. She could be relieved of those symptoms.
Thank you, sir. அம்மா, டாக்டர் சொன்னது உங்களுக்கு புரிஞ்சுதுங்களா?
Okay, madam. I can understand.
Okay. So,
I can chart all those things. My everyday work.
Okay.
And one time I will go for diagnosis.
நியூராலஜிக்கல் எவாலுவேஷன். ஸோ நியூராலஜிஸ்ட் கிட்ட போய் காட்டுறது உங்களுக்கு நல்லது. சரிங்களா?
Okay.
தேங்க்யூ மேம். தேங்க்யூ.
Thank you, madam.
Thank you, sir.
So
continuing
continuing
with the collaboration.
with the collaboration. So this is how physicians can help, the ENT doctors can help, neurologists can help. In terms of treatment also, like I just described to her. So if I'm suspecting a migraine and I make a neurologist referral, the neurologist will look and get it assessed, and based on the assessment reports, the neurologist will say, okay, it is migraine, then the medical line of treatment has to happen. Along with that, the audiologist could counsel and talk about these lifestyle modifications based on the charting and all that. And sometimes if all of that is not completely helping in relieving the symptoms, sometimes some vestibular exercises also help, but then the counseling has to be specific. We do counsel such patients and say that, look, what we are doing is you are trying to build a castle on the seashore. So you know when the next wave comes, this will be wiped out. You will have to start building again. So you have to be strong in your mind, know that I have to start like that. So that would be like a migraine case with a neurologist. If I know that there is somebody very old person, and this person is telling that, okay, it's not while sleeping or rolling in the bed that I get vertigo, but it's more while when I'm sitting down and I stand up, that time everything turns dark in front of me. For some time I feel like I might fall or something like that. This could be momentary 2, 3, 5 seconds kind of a sensation. This tends to tell me that this person requires a cardiovascular assessment, so should see a cardiologist who will get again the evaluations done. So depending upon what the patient is complaining about and what my test results are telling, I will make appropriate referral. Sometimes just for diagnosis, the treatment, the patient can still come back to me, or sometimes both for diagnosis and treatment, because not no professional can actually treat all the causes of vertigo. Your different professionals are needed. For example, a migraine, you can't have an audiologist or ENT treating a migraine patient. That would be, I mean, like making errors there. Likewise, if it is a BPPV or something like that, then it's more the ENT or the audiologist who treats it. So it depends upon what the symptoms the patient has. I would make appropriate referrals, and then depending upon their information, we could use that information to to either just make a diagnosis and then go ahead with the treatment, or take their input again for treatment purpose.
Thank you, sir. So now that we know what are the causes of vertigo and what are the symptoms and how is vertigo diagnosed, so as an audiologist working in mainly in the field of vestibular disorders, so how do we treat people with vertigo?
See, our role as an audiologist, when we look into our role as an audiologist, it is twofold. First is that counsel the patient, and counseling the patient is very important. It should be the first part of the treatment, because the patient should not get an idea that they have some severe kind of problem. And wherein some patient who come to me, they also say that while I'm getting this giddiness or having this vertigo, whether I have something problem in the brain, or I have some heart related issues, or whether from this vertigo I will get heart related issues or brain related issues, and eventually I will die, or this or that. They have many concerns which they have. So first part is that counseling. Counseling is to prepare them that there is no severe problem. If the problem, or if the disease is confined to the inner ear, in the labyrinth, mostly in the vestibular system, when it is confined, then we have to counsel it in such a way that they understand that yes, it is a problem which is related to the ear, and it can be treated, and there is no other problem that they have, and they are not going to have any other issues because of this kind of vertigo what they are experiencing. That is the first thing which should happen. After counseling, when you have counseled, you have to prepare them for two things. Disease wherein they have the benign paroxysmal positional vertigo, wherein we go ahead with maneuvers. So in BPPV, what happens is that there are some calcium carbonate particles in a particular portion of the ear which falls and it goes in the other part of the ear, and during the movement it creates the problem. So we have to do a repositioning maneuver, and wherein through the repositioning maneuver they become fine. That is the first thing which will happen. Wherein the person has a more constant damage to the inner ear, then we have to go for what we call it as VRT, vestibular rehabilitation exercises. Now, vestibular rehabilitation program is a customized and a special program, wherein what will happen is that certain exercises will be done, and these exercises will be person specific. That is, whatever the symptoms the person is experiencing, it will be designed as per the patient. And then what will happen is that either 2 weeks, 3 weeks, or 4 weeks, these exercises will happen. Now these exercises, the main purpose of these exercises is, first is that to reduce the giddiness or the vertigo. Second is that to reduce the imbalance. Third one is that uh, to make them more stable. And because what will happen is that most of the time patient, when they have vertigo, they will lose the confidence in the sense that when you understand that if I move, it is going to create a sensation wherein I'll feel that everything is going to move around me, or if I stand, I know that I am going to fall down. This patient will typically avoid the head movement, or this patient will not want to walk or not want to stand. So you have to give them the confidence. So we go ahead with the VRT, and the first line of treatment, it just starts the counseling, then maneuvers, and then vestibular rehabilitation therapy, wherein we go ahead with that.
Thank you, sir. Sir, with the treatment, so is there any lifestyle changes or modifications which patients with vertigo need to, they need to follow?
Yeah, lot of actually, and sometimes lifestyle modifications are directly related to the vertigo, so the patient can prevent getting a vertigo attack. And sometimes lifestyle modifications are to ensure that the vertigo does not cause any damage to them. For example, somebody who has a positional vertigo and looking down or turning towards one side causes them to feel vertiginous. So, till the vertigo is treated, they shouldn't be, I will tell them not to drive or ride. So, this is like a lifestyle modification suggested specifically to them, because during drive, a lot of times suddenly, reflexively, we turn to one side, and if the person has a positional vertigo, he turns towards one side, everything will start spinning, and he could meet with an accident or cause an accident to somebody else, so it could become dangerous. People who are having these kind of symptoms, I tell them, okay, do not stand near the edge of any roof or something, even if there is a boundary, because there is chance that suddenly you feel spinning sensation and topple over. So those kind of dangerous situations can be created by vertigo. But certain other conditions, like I just mentioned about vestibular migraine, there, knowing what is causing the vertigo to appear, I do know that, this is a universal truth that anybody who has a migraine, if he consumes red wine, is definitely going to have a migraine attack in 45 minutes to an hour's time. So when I know somebody has a vestibular migraine, I will tell them that, look, do not use alcohol. Or if I identify that, okay, somebody stays empty stomach, that can cause hypoglycemia, the sugar levels in the blood can come down, and that can cause a vertigo and headache attack to the person with a vestibular migraine. So I will tell them, have breakfast early, do not have a very long, we call it as a break fast, because we are supposed to break the overnight fast in the morning. So if you've had early dinner, make sure you also have early breakfast. You can't have an early dinner at 7 o'clock, because these days people are all very much fond of losing weight and all that. So because of that, they might want to plan their dinner at 6:30, 7 o'clock in the evening. Such people should have their breakfast before 7 o'clock in the morning. You can't have your breakfast at 9 or something like that, which will be a very long fast, and that can bring sugar levels down and cause vertigo attacks or migraine attacks to such a person. So such kind of lifestyle modifications are suggested, but these are person specific and specific to the conditions that they are having. I've just given you a couple of examples, but for each person it's different, it's not the same. So I need to look at what they do, what all causes vertigo in them, and depending upon that we suggest modifications like that.
So, and among the patients, there are few myths and misconceptions about vertigo, like it is caused due to this, due to this. Like, are there anything you would like to address about it?
Yeah, the first thing, we should get rid of all the superstitions. So it's not that you've done something wrong in your life, therefore you are getting vertigo. People will say, I must have committed some sins, therefore I'm getting vertigo. So such things are not true. It's not that. But the second more important misconception, which you have actually asked in one of the previous questions, where you said, are all vertigos life threatening? Because somebody gets vertigo, they shouldn't suddenly think that, oh, my life is finished, I will I have some very dangerous condition, I am no longer going to live, or my life is going to be short. It isn't like that for everybody. Yes, there can be a few conditions in which it happens, but those are more rare conditions, and there are other things associated with them which you know from before, like somebody who is very obese, is uh, very fat, and has a very high cholesterol level in the blood, and those kind of things. Yes, those kind of issues can cause vertigo and can also cause heart attacks and other things. So those people need to worry about them, means really not worry about that, do take measures to prevent that. But just worrying about something doesn't help. Therefore people should stop thinking that, okay, this is the end of my life will be finished, I can no longer do some work. Nothing like that. Vertigo is a problem which is treatable. Almost all vertigos are treatable, and they are treatable with ease most often. So you should never ever think that it's the end of my life, and for all my life I will be bedbound or I'll be needing people's help. It's not true. You will need people's help, but only when the treatment is ongoing. Once the treatment is done, you will be absolutely fine, and you will not be requiring people's help all throughout your life. So all vertigos are treatable, and therefore do not think that it's the end of my life.
Thank you, sir. And the last question, sir, would you like to guide the public, like once if they have a vertigo and once they come to Aish, what is the assessment and the diagnosis protocol that we follow mainly in Aish?
At ICE, we have a dedicated center of excellence for person with tinnitus and vestibular disorder. So once the patient they come to All India Institute of Speech and Hearing, they have to go through the routine registration process. And once they register themselves, they will be guided to the audiology department for doing the initial hearing related assessment. And once the hearing related assessment is done, then they come to the center of excellence for vestibular, and when they come there we have a whole set of tests which are available, and these tests basically which are available in our lab are vestibular evoked myogenic potential, video head impulse test, video nystagmography, craniocarpography, stabilometry, functional head impulse test. So we have several tests which are available. We have actually the state of the art facility which is available at our center, and not every center where the vertigo is assessed will have so many equipments and so many tests which are available, and that is where the patient will be evaluated, and whatever the treatment is feasible the patient will be guided, and if there are wherein we suspect some kind of neurological issues or some other issues, then we will make accordingly the other referral also to the other center so that they can go and get themselves checked over there.
Thank you, sir. So, to conclude, balance is important in our daily lives when it's affected by conditions like vertigo. So, it can significantly impact our well being also. But the good news that we have learned from today's session is that with proper diagnosis and proper treatment, many can regain their control and stability. So, I would like to sincerely thank our resource persons, Dr. Sujit Kumar Sinha and Dr. Neeraj Kumar Singh. So, thank you both for addressing the questions and briefing about the vertigo and balance disorders. So, we would also like to visit our website www.aishmysore.in for further clarifications, and follow us as lot more programs are yet to come up. And thank you all for joining us today. And let's continue to prioritize our balanced well being one steady step at a time. Thank you. Thank you, sir. Thank you, sir.